Welcome to the training module for Amend Healthcare. Our goal today is clear and specific: mastering safe medication self-administration. Our core directive at this facility is that staff are here to assist clients with their medications. You must never administer them. Administration requires a medical license to inject a drug or apply a patch to a patient. By contrast, self-administration looks like this. The client physically handles their own medication, picking up the pill and bringing it to their mouth while you observe and verify. Strictly maintaining this boundary protects your legal standing as a staff member and preserves the client's autonomy over their own care. To ensure every medication pass is safe, we rely on a strict checklist known as the 6 rights. This matrix outlines the 6 core pillars you must check before any client takes a dose. First is the right client. As this first pillar fills in, you can see the requirement: always verify 2 unique identifiers, specifically the client's full legal name and their date of birth. Next, we confirm the right medication and the right dose. Notice how the second and third pillars lock together here. The physical label on the container must be an exact 1-to-1 match with the Medication Administration Record, or MAR. The fourth check is the right time. Amend maintains specific scheduled dosing windows, shown here blocking out 4 periods: a morning window from 5:30 to 10, noon from 12 to 2, evening from 8 to 10, and bedtime from 8 to 10:30. Finally, we verify the right route and secure the right documentation. As these last 2 pillars fill to form a permanent record, keep in mind that you must document the exact actual time the dose was taken, rather than just the scheduled time. Beyond those 6 standard checks, Amend requires a mandatory 7-step at every medication pass: the mouth check. This step is straightforward but critical. You must visually confirm the client's mouth is entirely empty after they take a dose, ensuring the medication was actually swallowed and not held, hidden, or diverted. This 7-step process requires relentless repetition. You run this checklist at every single medication pass, for every client, on every shift. Systematically executing these specific checks intercepts severe medical errors while the pill is still in the cup, long before an incorrect substance can enter a client's body. We verify the right medication, dose, and route using a physical workflow called the Rule of Threes. You read the prescription label exactly 3 times: once when you retrieve it from storage, once when you hand it to the client, and once when you return it. Looking at this label, your eyes should hit the drug name, the dosage strength, and the route directions every time. Reading those route directions carefully prevents major physical hazards. For example, clients often find extended release or ER pills too large to swallow and will ask to break them in half. Crushing an ER pill disables its built-in safety mechanism. As this cross-section shows, instead of a controlled 24-hour slow drip of medication, breaking the pill causes an immediate, overwhelming flood of active ingredients into the bloodstream. A second major route hazard involves sublingual medications, like buprenorphine films. If a client swallows a sublingual film with water, stomach acid destroys the medication. The diagram shifts here to show the correct method. The film must sit under the tongue, absorbing directly upward through the surface barrier to enter the bloodstream effectively. Catching these form and route instructions during your 3 label checks stops a routine medication pass from turning into a medical emergency. Another high-risk scenario occurs when you receive a verbal or telephone medication order from a busy, rushed prescriber. To handle this safely, we follow a strict Joint Commission protocol: write, read back, and confirm. First, you write the complete order down immediately. Then, you verbally read the entire order back to the prescriber, word for word. During that readback, you must explicitly spell out the medication name to prevent catastrophic mix-ups. This graphic shows why. Drugs like Seroquel and Sinequan sound nearly identical over the phone, but spelling them out letter by letter catches the error. Finally, wait for explicit verbal confirmation from the prescriber that your readback is correct, and then flag the system so they can provide their required co-signature within the mandated timeframe. Having the confidence to slow a rushed prescriber down and enforce this readback rule is a core act of client advocacy. It is never insubordination. Keeping clients safe requires running the complete sequence: maintaining the assist-only boundary, executing the 6 rights plus the mouth check, and validating labels 3 times. Through all of this, the golden rule of the medication pass is simple: if anything on a label, a written order, or the physical pill's appearance does not perfectly match, Stop immediately and refuse to proceed until the discrepancy is resolved. Mastering these specific protocols fulfills strict Joint Commission standards and state licensing regulations. Strict adherence to these steps protects the client's health, shields your career, and ensures M&T Healthcare remains a safe place to heal.